So I think for us it really is pretty much the same. We've had the same singular focus, I would argue, for 95 years, and that is focusing in on the patient. Now, over that time, we've said it differently. Today, we describe it as being patients first. And I think as a result of that, we've had a lot of recognition around our ability to focus in on the patient and their experience, not just their medical care. I think one example of that has been a video that was developed at the institution by the Office of Patient Experience that really took a look at how does a patient, someone who's working in a healthcare facility, actually experience the care every day. So think of it as a look from the patient's shoes, from a employee's shoes, from a nurse's point of view over time. And when you think about that, it really does get to the core question of what we're doing here at the Cleveland Clinic, which is caring, truly caring for patients. And if you want to do that, you have to have empathy, not only for the patients, but also for your coworkers and anyone else who might be involved in the care process. So I would say it's both challenge and opportunity. I think over the last year, we have been focused on what work can we do to really drive the transformation of care. So how can we change the way we deliver care, no matter where it is, whether it's inside the hospital or whether it's transitioning care from the hospital or the doctor's office to other locations like the patient's home. So that care transformation process is very hard work, meaningful work, difference-making work, but challenging work. And so we've been working on a project that we call the Care Path Initiative, and it really is taking a look at what we've been doing to care for patients with very specific diagnoses. We started with patients who will probably need a hip transplant. We don't know the second they, not transplant, hip replacement. We don't know it when they walk through the door, but at some point we come to the conclusion that they actually are going to need that hip replacement. Now what we're doing is re-engineering the way we think about delivering that care, and it starts all the way at home. So we begin to collect information because the best judge of how well a hip replacement has gone is actually the patient. So we call that patient-reported outcomes. And we use internet-based technology to get the patient's interpretation of their functional status, how far you can walk, from them before they ever come in for that surgical procedure, so we have a baseline. Then we use that information to tailor the care path in terms of how we're going to care for the patient. And the care path includes all of the care providers, not just the doctors and the nurses, but it includes all the allied health professionals that will be involved, the physical therapists that will be involved, and it focuses not just on the hospital, but it focuses on where they're going to go for the rehab services and how do we connect with that patient at home when they're having home care services as well. So what connects that team that's working on a single patient, working on a single care path, but that the care is being delivered over a wide geographic area, is the information management component. It's the thing that's common no matter where the patient is going. And our biggest project in this last year has been focusing on building that tool. And it has just gone live at the Cleveland Clinic. I think it's one of the unique characteristics of the Cleveland Clinic, which is that innovation is a core value of the organization, and it always has been. So from what we have done is to drive a number of programs to really make sure we do not lose the focus on the importance of innovations. Now, for the clinicians in the organization, we sponsored what were called innovation days, so that they could take a day or two off, find something that they thought was novel, and go investigate it. And the only obligation they had was to bring that idea back and to report it out and to engage the institution in a conversation around it. So I think that's one way we've maintained it, thinking very broadly. Now, the other way is that we have an innovation center. It's called Cleveland Clinic Innovations, and it really is focused on finding those ideas that are fledgling in the organization. Someone has been tinkering away, but it hasn't gained scale. And so that organization's role is to identify those things, bring it into what we call an internal incubator, if you will, and develop that idea and decide whether it has real potential on a larger scale. So, for example, in my division, we had a little program that we called eResearch, and it really was an analytics tool built to hang off of the electronic medical record, but specifically to facilitate clinical trial support. So identifying those patients that would be eligible for a trial and simulating, if you actually ran the protocol, how many patients would be recruitable. Now, it sounds like a little idea, but for a big pharmaceutical company, if they don't get this kind of information, then they make the decision to start up a clinical trial, which costs them $1 million a day, and they don't actually know whether or not there are recruitable patients out there. So they could be spending that money day after day after day, only to find out they can't complete the study because they could never recruit enough patients. Well, in the age of the electronic medical record, that's knowable, and it fundamentally changes the way they think about designing a study. So that little development effort that we did for one reason, we recognized that it had real potential in the space of big data. But we also knew that we weren't going to get it there by keeping it in its original department. So we took it to Cleveland Clinic Innovations. The idea was developed, and in this case we decided to take it down the venture road so that it could get the capital that it needed to go forward. And today what I would say is that it is one of the leading companies in that space. So it has been commercialized, it's independent of the Cleveland Clinic now, it drew the venture capital that it needed, and it's actually a company that has a slightly different target. So it used to be this pharmaceutical space. Now really what it is the operational space of understanding what does it mean to care for, we see 10,000 patients a week at the Cleveland Clinic. How do we know that we're caring for them properly? What is their quality scorecard? Who needs follow-up? So it's really a big data analytic problem, and that's what this little fledgling company turned into.